everyone, and welcome back to my weekly Sunday 9 p.m. live video. I'm Dr. Tan Yiping, consultant, obstetrician and gynecologist. So today we are going to talk about two topics. Just like last week, I actually have one topic that is very current, which is on COVID-19, and the second topic is something very gynae related that was requested by one of you. So as usual, any one of you have any questions that is gynae related or COVID related, you can always post up in the comment section here. If it's relevant to today's topic, I will answer it today. If not, I will answer it in another day in the weeks to come in my weekly Sunday 9 p.m. live video. Okay, hi everyone, and thank you again. I see very regular names again and again every week following my video, and thank you very much for being my regular followers. So I think everybody is staying at home now and also feeling very stressed about our COVID-19 situation in Malaysia. Yeah, it's very sad. A lot of things I hear, a lot of things I see, and it is still very sad to see that a lot of people are still not wearing their masks, and that is something that I don't know what to say. Like for example, today before I went to work, I actually dropped by at Texas Chicken on the way to my clinic to order my breakfast. Okay, so when I went in, there were 3 staff in the Texas Chicken, the restaurant, and all 3 of them, even though they were wearing masks, they were all wearing masks below their nose. So if you wear your mask below your nose, it's not serving any purpose at all. You can get infected and you can also transmit infections. So a lot of people are still wearing masks below their nose, which I can't understand, because many of them will say that I cannot breathe. But to me, we have given you more than 1 year to get used to breathing with the mask, because if you look at all doctors and nurses, even before pandemic, we have always been wearing masks doing our work, and we can breathe. There's no such thing as cannot breathe wearing the mask. I agree, initially you're not used to it, but it's been more than 1 year, and why are you still not used to it? So sometimes when people ask me that why are the cases still going up despite lockdown, then my answer is very simple. It's partly because of the people. I mean, we like to blame the government. We like to blame the government cannot do anything, not doing the right thing. We can blame the government for all the things they have done wrongly. But I think ultimately it's still we are responsible as well, because when we go out, we don't wear masks. When we wear masks, we don't wear masks properly. So we don't protect ourselves, we don't protect other people. So the common mistakes that people are doing, I'm sure all of you know, is not wearing the mask properly when you're outside, not at home. And another thing is eating together. When you work, you like to eat together, because I understand it's human nature. Human nature likes to socialize, and when we work, usually it is only during the lunchtime, the tea breaks, that we get to sit around with our colleagues and chit chat and have some fun. If not, work is like so dull and boring and stressful as well. But at this time of pandemic, with so many cases, I don't think we should be eating with our colleagues or our friends anymore. So we should not even take down our masks when there's 2 persons in the same room. So I guess a lot of things that we see is not happening. That's why our cases are going up. So it's very obvious why our cases are going up. Number one is because the virus is already there, everywhere. It's everywhere. At every corner in KL, especially Klang Valley, it's at every corner. And then if you were to pull down your mask, you will get infected. That is as simple as that. So now why the cases are going up, I don't think we can blame government strictly. It's partly because of us. So everyone, yeah, please remember to wear your mask whenever you go out. Okay, then there is this very, very hot topic recently that everybody has been sharing. It has gone viral. People talk about Ivermectin. Ivermectin, the drug to cure COVID-19. Ivermectin. Even my father also showed me that. He said, Yiping, you know, this drug work, it work, save so many lives, He thinks that his daughter doesn't know about this drug. Actually, this drug, we already knew like half a year ago at least, and we have been talking so much about the drug, and in fact, doctors have been debating so much about the drug. We have been debating so much about this drug. There are a group of doctors that strongly believe that it works, and there's also another group of doctors that strongly believe it doesn't work. I tell you, the debate in the doctors group can go like 100 over comments in 1 hour, crazy, but that is exactly what's happening. So what is Ivermectin? Let me tell you what is Ivermectin. Ivermectin, number one, it is a drug that has been there since 1987. So 1987, long time ago, right? More than 30 years already. So number one, we have this drug for so long, but we use it for other purpose. We use it for what? We use it for scabies and head lice, you know, head lice, kutu, head lice and scabies. Scabies is those infections around your hands. We have been using that for more than 30 years, but not in Malaysia. In Malaysia, it is only licensed for use in animals. So the animal doctor has been using Ivermectin for animal. So let's say you have a monkey with lice, you know, kutu on the monkey. Monkey whole body full of hair, right? So they use drugs like Ivermectin to get rid of the lice, to get rid of scabies. So in Malaysia, it has only been licensed for animal use, not for human use. But there are countries out of Malaysia, not many countries in fact, very few countries only, that actually license it for human use all this while. But we know human can use. And we know we already use it for more than 30 years, especially in countries that are licensed to use. They have been using Ivermectin for more than 30 years. And we know that it is effective for head lice, for scabies, and also we know that it is actually safe. You can take it, it's a relatively safe drug. I cannot tell you that it's 100% safe because there's no drug in this world that's 100% safe. But it is a relatively safe drug. Not much side effect, not many people have any severe side effect from this drug. So it is safe to use. Then why suddenly this story about Ivermectin and COVID-19? So somebody actually did a research. They used Ivermectin in the lab. And in the lab, it has been shown that Ivermectin can kill COVID-19 virus. Wow, isn't that good? Ivermectin can kill COVID-19 virus in the lab. But in real life is another story. Because in real life and in the lab is not necessarily the same. So what is happening in real life? Number one, we know that when we take Ivermectin, the dose of Ivermectin in our blood is not that high compared to the dose of Ivermectin they use in the lab. The dose of Ivermectin in our blood, if we pop in the Ivermectin tablet, is 9 times lower than the dose of Ivermectin that they use in the lab. So we don't actually know whether this Ivermectin can kill the COVID-19 virus in your body. So people are not sure. Possible, but not sure. So what we need to do is we need to do research. So there are many research all over the world, because I always like to say desperate times require desperate measures. You see, why is Ivermectin viral now in Malaysia? Actually, Ivermectin, we knew it since last year. But why is it only viral now in Malaysia? Because we are desperate. And if you look at when people quote to you, India use it, Thailand use, Indonesia use it, Philippines use it, and we know that their COVID-19 was very bad long before us. And when they were desperate, they were like grabbing anything. Or maybe this will work, maybe this will work. Everything we try, okay? So we try everything. So people have tried. And in fact, a lot of research has been shown that have been done, but there are problems with the research. Number one, it doesn't show any conclusive answer. In the research that has been done on humans over the last 1 year, it has not shown that Ivermectin worked, but it also doesn't show that Ivermectin doesn't work. Why? Because the research are already small number. I give you Ivermectin, you get cured. Is it because of Ivermectin? Maybe not. Because many people who never take medicine with COVID-19 also get cured. So we cannot say that this who take COVID-19 and survive the COVID-19 means it's due to the medicine. We cannot say that, because we can also say a lot of other people that never take Ivermectin but also survive from COVID-19. So because of that, it's very hard to prove that Ivermectin work. So when you want to prove that Ivermectin work, we need to do very big research. But unfortunately, the world has been doing very small research. So at the end, nobody knows whether it works or not. And there is one country, very interesting country that everybody like to quote, is Peru. Because Peru actually asked the medical people to use it since May last year until March this year. And from March this year, they stopped using already because they found that it didn't work. Despite using Ivermectin for like 10 months, almost 10 months, but people are still dying of COVID-19. So it doesn't seem to work. Even in India recently, they have already advised to stop using, although not all doctors listen, because they found out that it doesn't really work. But in research base, we still haven't proven anything. But in the lab, it shows that it works. But many countries who have been using Ivermectin, people are still dying. So you need to understand Ivermectin. Few things. Number one, it is not licensed to use in Malaysia on humans. So now we actually allow it for emergency use purpose only in research setting. So if you are going to be given Ivermectin, you are given Ivermectin as an experiment, as a research, because we really do not know whether it works or not. But as usual, desperate times require desperate measures. We don't know what else works. If we have something that potentially works, I am sure everybody is willing to try. But you can only try under doctor's supervision. Because it is experimental, it is under research, we do not know whether it works or not, and we do not know whether there will be any side effects on you or not, because it is on experimental basis. And there are also a lot of worries about Ivermectin. What is the worry? You see, when we give medicine that is supposed to work, but we didn't give the enough dose, because instead of giving 9 times higher, we only give the standard dose. We know the standard dose is safe. 9 times higher dose, we aren't really sure. We don't know whether it's safe for you to take 9 tablets at the same time instead of 1 tablet at a time. So we don't know whether it's safe. But we know that at this dose, may not be enough to kill the virus. So when you give a medicine that is supposed to maybe make the virus less strong but not die, what is going to happen? Typically, like antibiotics, antifungals, we know any medication, whether antibiotic or antifungal, that is not strong enough to kill the germ, but whether it's a bacteria or a fungus, but even though it can inactivate it, but it's not strong enough to kill it, what happens at the end? It forms resistance, because these bacteria and fungus, what happened to them? They mutate. They form a new variant that this medicine will not work anymore. So that is the thing why we worry, because maybe we don't know. Maybe Ivermectin is the only drug that will work for COVID-19, but we need to do it like a higher dose, not at the dose that we are giving. But we do not know what dose is safe for a human, at the same time effective for COVID. We don't know. And now we are already, everybody taking Ivermectin. And what is going to happen? We really worry that the virus will mutate, and ultimately Ivermectin will not work anymore. So that is one worry that we really worry with the use of Ivermectin. That's why we don't encourage actually the use of Ivermectin in large numbers. You want to do it under experiment? Yes, because somebody needs to find the answer whether things work or not, but not in large numbers. So it's definitely not recommended for the use for everyone in the country. But as I will say, desperate times require desperate measures. Everybody is trying to find ways to save the loved ones, because we know that many people are dying, especially with the new strains, which happen to be a lot more stronger. The virus is a lot stronger and people are actually dying. So that's it I have to say about Ivermectin. So in summary, it is not licensed for human use in Malaysia. Whatever we are doing at the moment is for, and it's not licensed for COVID-19 at all over the world. The only reason why we are using it is to use it for experiment basis. So if you ever get Ivermectin, it has to be under experiment, and you need to know you are only under research basis, and you need to be taking it under supervision of the doctor. Yeah, don't go and buy on your own, okay? You need to take it under supervision of the doctor, because I'm really worried when you buy it on your own. What if you got the monkey dose, the elephant dose, the horse dose, and not the human dose? You must know that animals are a lot heavier than us. The doses are a lot higher, okay? Alright, that's on COVID-19. So now I'm going to talk about something that is very gynae related. That is a question that was posted up by someone. She has irregular menses, and she's actually worried whether she can get pregnant or not. Actually, I think a lot of women who have irregular menses always have this question in their mind, whether will they be able to get pregnant if they get married, you know. So there are a few things you need to understand about these irregular menses. There are two situations of irregular menses. One is those people who all along have irregular menses. You have irregular menses since you're a teenager, in your 20s, in your 30s, forever irregular menses. There's another group of women that usually have regular menses, but at a certain point of their life, they started having irregular menses. Ultimately, there is one question you need to answer. There's only one question you need to answer. Because a lot of patients will come and tell me, Doctor, somebody said I'm PCOS. Do you think I have PCOS? Or sometimes they call PCOS. Doctor, do you think I have PCOS? Because some doctor told me I got PCOS. Do I have PCOS? Is it because I have PCOS I cannot get pregnant? You know, to me, I will always tell them this thing. Whether you have PCOS or not, it is not important at all. It is not important at all. Whether is it because PCOS cause you cannot get pregnant, it is again not important at all. It is not important at all. Because number one, PCOS is defined as polycystic ovarian syndrome. It is a syndrome. It's not really a disease. It is a syndrome. It is not a disease. It is a syndrome. It means that it's some features that we see in a collective syndrome. We say it's a collective of features. So there are certain features. Some person have a certain number of features, and if you fit that certain number of features, means you have polycystic ovarian syndrome. So it is not important at all. When it comes to pregnancy, it is not important whether you have PCOS or not. Whether you have regular menses or not regular menses is not important at all. What is more important? What is more important is whether you ovulate or not. Because we know that when you have irregular menses, you must understand that women have two types of menses, which is ovulatory menses and non-ovulatory menses. So when you have menses, it doesn't mean you ovulate. So we want to know whether you are ovulating or not ovulating. One thing we know, women with regular menses, they usually ovulate. If your menses is regular, you usually ovulate. Not 100%, can say 99% of the time. But when you have irregular menses, then number one, you could be not ovulating, or you could be ovulating, or you could be ovulating sometimes but not always. What I mean, like you have irregular menses. Let's say you only got 8 menses in a year instead of 12. Out of the 8 menses in the year, it could be all 8 not ovulating. It could be all 8 also ovulating. But it could be 3 ovulating, 5 not ovulating. So 3 different scenarios. So it could be, we don't know. So how to know? We have to do scan. We have to do serial scan to catch your ovulation. The only way to do that is to do serial scan, not do blood tests. A lot of you come with result with the blood test of day 21 progesterone. If your period is not regular, your day 21 is no longer correct. Because that blood test, it is a very particular blood test. You have to do it on the correct day, which is 7 days before your next menses. Think about it. 7 days before your next menses. If you don't even know when is your next menses, how to know what is 7 days before your next menses? Am I right? So there's no way you can tell. So this is the thing that you need to understand regarding this cycle, ovulation or not ovulation. So you cannot be using blood tests. You need to really look at serial ultrasound scan to catch your ovulation. If we can catch your ovulation, means you're ovulating. If you are ovulating, it doesn't matter whether your period is regular or not regular, you will still be able to get pregnant. But if you're not ovulating, then you will never be able to get pregnant. Let's say you have 8 menses in 1 year and all 8 menses never ovulate. How to get pregnant? Impossible to get pregnant. If you have 8 menses in 1 year, but you have 3 that's ovulating, 5 that's not ovulating, of course you can still get pregnant, but your chances is not so high. It may take time. So, my only advice for women who plan to get pregnant, if let's say you plan to get pregnant and you have irregular menses, the first thing you need to know is never try to get pregnant on your own for years before you see the gynae. That is like the stupidest thing to do. Why? Because if you're not ovulating, you wasted the number of years. It's very typical. Women come to see me after 2 years, 3 years, 4 years married. Married for so many years, period is irregular, never seen gynae before. Because they're not pregnant after so many years, then only they come and see gynae. then I will tell them, you have just wasted so many number of years. So what is the best time to see gynae when you want to get pregnant? If you have irregular menses, you should see the gynae the moment you want to get pregnant. Like this month, I want to start getting pregnant. This month, I'll see my gynae. I want my gynae to let me know whether I'm ovulating or not. Because if I'm ovulating, then okay, I chill. I go back, I try and get pregnant on my own. But if I'm not ovulating, then I want to start treatment. I start treatment straight away. Because this is what I did for myself. I also have PCOS and my menses have never been regular all my life. So the moment I plan to conceive, I immediately start medicine. I knew I'm not ovulating, no need to waste time. Straight away start. Okay? So that is the most important message I hope that you get. If you plan to get pregnant and you have irregular menses, you should see the gynae the moment you want to get pregnant. To ask the gynae whether I'm ovulating or not. Whether I need any medication to help me ovulate. Because if I'm not ovulating, I want to start my medication now. I don't want to waste 3 years, 5 years, and then only I know that I have this condition and I'm not ovulating and I wasted so many years. Okay? So if you want to know more about PCOS, I have other videos on PCOS and irregular menses as well in my YouTube. So you go to my YouTube channel, Dr. Tan City's Clinic. Remember, to subscribe and like my videos and turn on the notification button, okay? So for PCOS, if you want to know more other than the aspects of fertility, you can always go to my YouTube channel, okay? Amy asked if on Yasmin for adenomyosis and planning for pregnancy, when should I stop my Yasmin? You stop today. After 1 month, you can. Actually, you don't need to wait to get pregnant. But most of the time, we ask people to wait for 2 menstrual cycles. Reason is not because of the effect of Yasmin. It's not because Yasmin cannot get pregnant. No. You can get pregnant even when you're taking Yasmin. There's no problem. But only thing is that we want your menses to come regular back before you get pregnant. It's all purely based on whether or not just so that we know when you got pregnant actually. Because when you get pregnant, we always count your due date and your timing of getting pregnant and your number of months of pregnancy, all based on your last menses. So if you take Yasmin, normally after you stop your Yasmin, your menses will be irregular for a few months. So that few months actually is haywire one. So if you get pregnant, then it's not easy to count, or we may count the dates wrongly because actually your menses is not regular yet. It's not really a big problem because ultrasound can solve that problem, because ultrasound machine can count your due date anyway. But some of you come to us like 5-6 months pregnant, so then it's too late to change your due date. So then it can be a problem. So that's why we advise women to wait for 2 normal menstrual cycles before you get pregnant. But it is not a must. Okay. Okay, Laureen Tan asks, if breastfeeding with regular menses, is it possible with non-ovulating menses? Okay, as I say, if you're having regular menses, it doesn't matter whether it's breastfeeding or not. 99% of women actually have ovulating cycle. 99, not 100. Usually regular means ovulating, but it's not 100%. So we can't tell. If you are not sure, you can always just go and visit your gynae. Go around like day 14, day 13 or day 12, at least day 12 onwards, and just ask your doctor whether you are ovulating or not. Mei-Ling asks, I gave birth 6 years ago and trying to conceive second baby. Period has always been irregular. Do I need to check if I'm ovulating or not since I was successful the first time? Yes, Mei-Ling, you need to check. Because people can be ovulating all along and now not ovulating. Especially when you talk about things like PCOS. PCOS worsens with age. When you are younger, your period may be irregular, but you may still be ovulating. When you grow older, your period is irregular. Half of it will be ovulating and half of it is not ovulating. When you grow even older, then it can be totally not ovulating. That is number one. Another thing with PCOS is, as you put on more weight, then you become more, you actually stop ovulating. So typically a lot of time we notice in women is when they get pregnant, they put on a lot of weight. They put on 20 kg, 30 kg. So by the time you put on 20 kg, 30 kg, after you give birth, you're no longer the same weight as you were before you were pregnant with your first baby. And that would have stopped your ovulation as well. So definitely, Mei Ling, you need to go and see your gynae to check on your ovulation status, yeah? Because if not, you may actually be totally wasting your time. I just want to just share one case that happened in one of the hospitals recently. And you know, nowadays everybody goes to hospital, you need to have a COVID test done. Yeah, so but sometimes COVID tests need a bit of time for the results to be out. And so we had one case whereby they gave birth, and after they gave birth, they actually took a two-bedded room. And when they took the two-bedded room, one of them, how would I say, the story was like that. When the patient came in, her COVID test was negative. But somehow after she gave birth, she found out that somebody in her family was positive, and then we repeated her COVID test for her, and then she was positive. But she was in a two-bedded room, so sad to say, because the person who slept next to her now have to be quarantined. So my general advice for you, yeah, I mean, quarantine, it become a hassle, but most importantly, you do not want to be COVID positive, okay? So everywhere you go, please wear your mask. If you go to the hospital to give birth or whatsoever reason, if possible, take single room lah. Take single room, then at least you're all alone in your room. It's okay to take down your mask. But if you take two-bedded or four-bedded, then always keep your mask on, yeah? Because nowadays, the virus is everywhere. As I say, the virus is everywhere. You don't need to see humans to see virus here. So even if you're in a place that, you know, you don't see anybody near you, but the virus could be in the air, so better just keep your mask on. If not, then take a room that is all to yourself. Then at least it will be safer to take your mask off if you're all to yourself and nobody else in your room. If you're going to share a room with other people, please make sure that you still keep your mask on, yeah? Vaccinated or not vaccinated, COVID test done or not done, people is negative or positive, we don't care. We always keep our mask on, and that is the most important thing. Actually, if you look around, most of the people who got COVID positive is because they were exposed when they took off their mask. So if you take off your mask, definitely you have chance to get COVID, okay? So always put on your mask. Number one, never wear your mask below the nose, below the chin, never. At this time of age, with so many cases and the virus in every corner in our country, please don't wear your mask the wrong way. Always wear it properly, and don't eat with anyone outside. Don't eat with anyone or drink with anyone outside. You should always keep your mask on at all time. You only should eat in a private area, in a private room that only you are there, okay? No more socializing with during meal times. Don't ever do that, because that is the main cause of a lot of workplace cluster. Yeah, there's so many workplace cluster. It's all due to the meal hours, the drinking hours, the tea time, and also not wearing the mask properly. Okay, and so that's all for today. So before I end my video, yeah, so remember to go to my YouTube channel, Dr. Tan City Clinic. Please subscribe and also like my videos and turn on the notification button, yeah. And for more explanation on PCOS and all the things that's related to PCOS, you can always go to my video for PCOS, irregular menses, and weight gain that I had a long time ago. It is there in the YouTube channel. Okay, so that's all for now. And yeah, for Ivermectin, to summarize everything, Ivermectin is not licensed for COVID-19 infection, and in Malaysia, it was never licensed for human use. So if you are going to use Ivermectin for COVID-19, please remember it's only for experimental purpose, and it has not been proven to be effective. Okay, so we don't actually know whether Ivermectin is effective or not, but I guess there's no harm taking, but you can only take it under experimental purpose and under the doctor's supervision. So that's all for now. Stay safe, everybody. So remember, keep your mask on at all time. Thank you. Bye bye.